So when you need to think about what are the trends that are really impacting healthcare that you, your facility, and your board need to begin to work on, I want you to keep in mind that macroeconomic context. Debt and demographics are going to drive new changes in healthcare. They are what is behind the push to lower reimbursement in healthcare and to create new methods of reimbursement. And we've talked about some of those methods earlier. So now we have to ask ourselves if Washington is going to drive us to new payment, if Blue Cross and Blue Shield is going to drive us to new payment, and we have to be more efficient in order to make it, what are the real key strategies that it's going to take for us to succeed as an industry? So again, I want to emphasize what I believe are critical conclusions around healthcare today. The macroeconomic problems that we face as a country are going to be the same regardless of the faces that are in Washington. There's also no evidence at all that should Republicans take over the White House and take over Congress come post-election, there's absolutely zero evidence that they want to keep payment of fee-for-service the same. So at a minimum, you and your board and you and your health system teams need to be asking yourselves, if fee-for-service is going away, what is our new strategy? How are we going to position ourselves to get ready for bundled payment, value-based purchasing, and all the things that are coming down the pike? So, won't this go away in 2012? No, we already know what happened with the Supreme Court. They upheld the law. I've told you some of the evidence around Republican policy issues and the fact that they are not looking to maintain fee-for-service, and we know the debt problem does not change. So where are hospitals going? What are the things that they are working on? I think there are 5 key strategies that really becomes the playbook that every health system needs to begin to think about. One of those is to grow share and create leverage with payers. What do I mean by that? Health systems have typically been focused on growing share in the cardiology unit, in the orthopedic surgery rooms, etc. Not that those don't matter anymore, they do. But there is a shift to growing share to create a robust level of primary care lives. If the funding mechanism is going to come through in a capitated or global model, come through the number of primary care lives that I have in a market, then that becomes critical for me. And so you will understand and begin to see health systems are purchasing or affiliating or joint venturing with small hospitals in smaller communities, not so much because they want the hospital beds, it's because they want the primary care lives in that market. A second strategy that becomes important is reach for scale and efficiency. If you cannot make a margin or at least break even on Medicare, this is going to be a very difficult time. And so almost all systems across the country are trying to figure out, how are we going to cut 15% of our costs? Because we need to be able to make money on Medicare. Driving scale, driving for efficiency becomes critical. And then third, it's about redesigning the way you deliver care, redesigning the processes and the models that you use so that there is no redundancy, so there are no unnecessary tests, and so that you can improve value to both employers, the government, and payers who are going to begin to reward you or penalize you based on how efficient you are and how good your quality outcomes are relative to the competition in your marketplace.